Hello, I'm
Hi.
Krista. I'm one of the student nurses. I'm going to do a head to toe physical assessment for you today. How are you?
Great, thank you.
Good. And can you just state your name and today's date, please?
Lindsay McComas, and it is 6/23/19.
And where are we today, Lindsay?
We're in the clinic.
Okay, great. If at any point during the exam, if you have any pain or you need any clarification on what I'm asking you to do, please let me know. Okay?
Absolutely, thank you.
All right, thank you. So Lindsay is alert and oriented times 3. She has clear, coherent speech. It is dressed appropriately, is good hygiene, and we will proceed. So throughout the exam, I will palpate or auscultate or have my hands on your body. Anytime if that is not okay or anything has pain, please let me know. I'm going to start with just inspecting your head and your hair. Okay. Everything looks symmetrical, eyes symmetrical, nose is midline, ears and the campus of the eyes are symmetrical. We're going to palpate. Normal cephalic, hair is soft, evenly distributed, skin is warm and dry, no rashes or lesions noted. Are you having any pain here?
No pain.
Alright. I'm gonna just lift your eyelids a little bit here. If you look down and then look up. Alright. The conjunctiva is pink and moist. The sclera is white and clear. I'm gonna palpate your lacrimal ducts. I can say that. Are any pain when I do that?
No pain.
No, perfect. Okay. I am going to do a few vision tests with you. So we're gonna check your pupils. Just keep looking at me, straight at my nose. I'm gonna just shine a little light. Okay, sorry. So that's great, I'm sorry. So your pupils are round, reactive, reflex is noted. I'm gonna look a little closer to examine your eye, okay?
Sure.
I'm gonna carry on that. Sorry, try not to blind you. So, optic disc is creamy, yellow, no, why can't I talk right now? No nicks, cotton balling, no hemorrhages noted. Let's see, what else am I forgetting to do here? So, I'm gonna also have you just do some ocular motion movements for me. I can't speak, but can you just keep looking at my nose and just follow my finger, please, okay?
Sure.
Oh, don't move your head.
Oh, sorry.
It's okay. Go up. I'm gonna do this one again, chain you all the way out. And then follow my finger in. Alright, so ocular motor is good, your eyes look great, so cranial nerves 3, 5, and 7 are intact. Can you close your eyes for me and tell me when you feel something and where you feel it on your face? Okay.
Left cheek, forehead, right cheek,
Thank you.
chin.
Alright, perfect. You can open your eyes. Can you raise your eyebrows for me? And close your eyes really tight and open them. Can you smile with your teeth? Stick your tongue out. And can you puff your cheeks out like you're blowing? Perfect. I think that's cranial nerve 5 for the sensations. And let's see, so we've done that. And then we're gonna do ears. Hopefully I'm not missing stuff. And so I'm gonna look inside your ear, okay?
Okay.
Alright, so, sorry, I'm gonna tuck your hair back. Okay, so the outside of Lindsay's ear is pink, it's dry, there's no lesions, there's no bumps. And we're gonna pull it back, take a look. internal exam shows that the ear is pink and no cerumen is noted, and the tympanic membrane is pearly gray. Do this ear as well, sorry. All right, that ear is same tympanic membrane, it's pearly gray, no cerumen noted, no lesions, no masses. All right, and that didn't elicit any pain for you?
Nope, no
No.
pain.
Perfect. All right, so can you close your eyes so there's no cheating? Can you tell me if you can smell this?
Mm-hmm.
What does that smell like?
Smells like coffee.
Perfect, thank you. Sorry, did you get a big whiff? Oh, and then can you press one of your nostrils and try that again?
Coffee.
All right, and oh, here I got some else for you to smell. That'll be fun.
Oh, good. Alcohol.
Yay, okay. So cranial nerve 1 is intact. And so now we're going to look inside your nose, okay? All right. Is the light on? Yes, okay. Hang on. 1 second,
It's on.
Lindsay.
It's on.
Is it? God, why is this? It just didn't look on. It was really light. All right, bye. Try not to. All right, so there is, I'm trying not to pick your nose with this. So the mucosa is pink moist. There is no deviated septum. There's no masses. That's good. All right, so then we are going to palpate your jaw. Can you open and close your mouth? Thank you. That no clicking is noted. So then we are going to, oh, I also need to do your cervical node while we're here. Okay. This is a really good passage and I can't open anything. So I'm gonna use a light so I can see what I'm doing. All right, so if you can open, I'm just gonna inspect really quick. So your oral mucosa looks pink. It is moist, there are no lesions, no masses, no rash or anything. Can you lift your tongue and touch the top? The underneath is the same pink moist. All right, now I'm going to have you say ah. All right, and stick your tongue out at me and, sorry, I didn't want to get you really. Okay, so gag reflex is intact, uvula is symmetrical, tonsils are visible +2, right? Let me, is that what it is? It's +2? Is it +1? Okay. Okay, so now I'm going to palpate your lymph nodes. So there's your cervical lymph nodes back here. Oh, the occipital lymph nodes. This is amazing. Okay, and then the pre and post auricle. And then we have the mandibular and the tonsillar and the submandibular. No, why can't I remember this? Okay, but we're just doing all these. There's no nodules or anything noted. And then we're gonna come down here. Can you palpate the thyroid? Can you swallow for me? Okay. And then we're going to do, these are the pre-clavicular lymph nodes, and then the post-clavicular lymph nodes. No, nothing noted, and then we're gonna do axillary lymph nodes. And then we would do that on the other side. Thank you, you're very helpful. But there are no abrasions, no lesions, no masses, no hard nodules noted on that exam. Okay, what else did I forget to do? I think that's everything.
So that's what we're in PMI.
Right. Okay, so now we're going to auscultate. Can you, for this portion, just so the video can see, would you mind swinging your legs around so that I can, thank you so much. All right, so we're gonna listen to 8 different respiratory fields, okay? So I'm gonna have you breathe in and out for me. Again. Okay. That's 4. Thank you. You're not hyperventilating yet, are you? Alright. Oh, don't go anywhere, please. Alright, now, can you say the letter E? Or no, the word 99, I'm sorry.
99, 99, 99,
Again.
99, 99, 99, 99, 99.
Alright, and thank you so much. And then can you say the letter E?
E. E.
Again.
E.
And then can you take a deep breath in and exhale. All right, thank you so much. You can send your legs back around if you like. So chest expansion is symmetrical. There is no adventitious breath sounds. Everything is clear. Oh, I don't remember. There's no crepitus palpation. I'm gonna have you breathe in and out again for me. Thank you. And then, sorry, go around everything. All right, same clear breath sounds, no adventitious sounds, asymmetrical chest rise and fall. So now we're gonna listen to, sorry, that was my sneeze. We're gonna listen to your heart. So we would go second clip. So second intercostal space, mid-clavicular line. S1 and S2 are noted, right? No rugs, no S3 or 4. And then we're gonna go second intercostal space. And then we would go, it's kind of third intercostal space, and it's like near left sternal border. This is Erb's point, and I should have been pointing out what the other ones were. And then this is interesting, so we'll just try to get in here. Fourth intercostal space. And then this is gonna be fifth intercostal space. That's better, now I can hear. Mid-clavicular line. And this is very good. You would listen to that for a minute to get a apical pulse, right? So I'm going to have you lie flat so I can do that exam again. Sorry about that.
No problem.
All right. And then, all right, so here we are. Second intercostal space, mid-clavicular line, aortic valve, right? S1 and S2 noted, no gallops, no murmurs. My stethoscope has got a weird twist on it. So this is tricuspid mitral valve, second intercostal space, and I would totally flip and listen to this with both the bell and the diaphragm side of the stethoscope, by the way. So, third intercostal space, Erb's point, and then we would do fourth intercostal space. You would listen, and then again to the fifth. There. Fifth intercostal space, mid-clavicular line, and then can I have you roll onto your left side for me? Thank you. I'm gonna try to listen to that again. And flipping. And I'm gonna just rotate backwards. Since we're here. And then, sorry, one more time up here. to try to palpate PMI right here. Well, there it is. So it's about 1 centimeter right here at the fifth intercostal space, midclavicular line. You can sit up. Thank you so much. All right. So there was no murmurs noted. There's no clicks. There's no rubs. No adventitious sounds. No pain when we were doing any of that exam. Okay. That's good. So now we have to go to abdomen. I guess I could have left you laying down. Sorry. Can you go ahead and lay flat for me?
No problem.
Okay. I'm gonna listen and palpate your abdomen, okay? All right.
Sounds
Is it okay if I bring your shirt up a little
Of
bit?
course.
Okay. Thank you. Okay, so we're going to listen to the right upper quadrant. We would do this for a full 60 seconds. And in each quadrant, we would listen for a full 60 seconds. And we have normal active bowel sounds. We can also listen to the aorta when we are here. And then our renal arteries. And our iliacs. Right? And then our femorals. And then I'm gonna try not to whip you with that. So I'm gonna do some soft palpation here, right lower quadrant, left upper. This is not hurting you at all, okay? And then we are going to do, can you take a deep breath in and let it out? Any pain there?
Okay.
All right, can you extend this right leg straight and up? Are you having any pain there?
Okay.
Okay. So a sign is negative. And then can you flex your leg and rotate? Are you having any pain?
No pain.
All right, and that's the overtrator sign. I don't say anything right. And then there's on this side, there is, we're going to, okay, tell me if you have any pain here. Breathe in and out. Any pain there? Okay, and that's Murphy sign is negative. I think that's everybody's sign. So palpated, so there's no masses, skin's clean or intact, no lesions, no masses or tumors noted on palpation. We're gonna percuss here, let's see. And this is always fun for me. Percussion is dull. And we're gonna say that liver span is about 6 centimeters. Okay, and I think we will also, gonna palpate your femoral pulse 2+. All right, and then your inguinal lymph nodes. There's no nodules noted, no masses, no tenderness, nothing is hurting you.
No.
Okay. Yeah, it's like a T, so if it was like, remember that. Okay, perfect. We could do radial pulses. That's 2 + 2. We will do pedal pulses for fun, post-tibials, and skin's warm, dry, intact. Circulation is good on the extremities. Within 3 seconds, cap refill, no swelling noted, no edema. Skin turgor is good. I'm gonna do some deep tendon reflexes. Okay.
Okay.
So, the easiest ones to get since you're here. Let's see, maybe. No.
That's mine.
That's your dead knee? Okay, so that's, you're gonna pretend to be normal? Perfect. Well, okay. Can you, is that your dead one?
I have 7 surgery on that one.
Oh, jeez. Okay, so
And
then,
electric.
and then, oh, I don't know how to do the heels off the top of my head, I have to remember, so.
Going to back.
You're not gonna feel anything.
And then you have to tear that up a bit.
Okay. Ready? Relax. In my video here. Okay, so that's a negative Babinski, sorry, but we don't want a positive one.
Right.
Alright, so then there is a brachiocephalic, which is about 10 centimeters
Mhm.
or so there. And then there is somewhere in here, we'll see if we can get you to elicit it. Can you relax your arm? There we go. Let's see. I don't know. Alright, and then the tricep. Okay. Sorry, am I like twerking you in a different way? Okay, that one's a little harder to get though. Alright, and then on this side, the brachiocephalic, 10 centimeters, yeah, very nice.
Sit your nerves.
Okay, so it's something like in here somewhere. And then relax in here. It's supposed to be right in there. Oh, did I get it that time?
Yeah.
Okay, I'm not left-handed. Okay, so we've got all our deep tendon reflexes. Let's do some range of motion. Can you lift your head and look at the ceiling and then bring your chin down to your chest? Thank you, like normal. Can you look over your right shoulder and left shoulder for me? Perfect. So full range of motion, cervical. Can you shrug your shoulders? Can you relax them? Can you bring your arms out to the side? And can you face your palms towards me? Close your eyes. Touch your right finger to your nose and back out. Do the same with the left. Can you touch it? That's perfect. All right. And you can relax your arms. Can you lay back flat for me for a second? And can you bring your right leg out straight and lift it and hold it up for a couple of seconds? Perfect. Relax that leg. Can you do the same with the other? Lift. Perfect. Now can you relax? Now can you bring both your knees up to your chest? Full range of motion there. Can you do, it's kind of funny, can you do like a frog leg position? Perfect. Any pain there? Okay, relax. Can you touch your right heel and run it down your left shin for me? And can you do the same with the opposite leg? Thank you. So we have full range of motion on hips, legs, arms, shoulders, cervical. Can you sit up for me? We're gonna just have you stand. Don't get lightheaded. And, oh yeah. I'm going to just percuss here. You don't have any pain?
Okay.
Perfect. And then can you do me a favor and just walk a few feet that way? And that's good, stop. And when you come back, can you do your heel in front of your toe, kind of walk like this for me? Perfect, thank you so much. You can have a seat. So we have steady gait, we have full range of motion, we have done quite a few things, I think. Okay, so now we're going to do a couple last little exam components. Can you put your palms out like this for me? And I'm gonna try to press down, just don't let me, okay? All right, and do the same, I'm gonna press up, don't let me. Perfect, you can relax your hands. we're gonna do the same thing with your shins. Can you try to push up? All right, and then push down. This is perfect. Do the same with your feet. And push up. Okay. Oh, thank you. So good strength, even on both extremities, and upper and lower. And you already did shoulder, so these are all intact. Let's see. So we're going to go back and do, I'm going to place this little tuning fork on the top of your head on the sagittal line, a suture. Thank you. And you let me know if you can hear it in one ear or both, or if it's equal, or one side's better than the other. Okay, we'll get my sentence out eventually.
No worries.
Okay. Let's see. There, it should go.
Both bilateral.
You can hear it the same?
Mhm.
All right, perfect. Now I'm gonna put this again, but I'm gonna place it behind the ear on the mastoid bone, and just let me know when you don't hear it any longer.
No.
Can you hear it? And tell me when you don't hear it any longer.
No.
All right, so we have a 5-second difference in bone conduction and hearing. Can't even talk anymore, it's all right. Get on this side. Tell me when you don't hear it any longer.
No.
And
No.
all right, perfect. So I think that is everything. So when we've done cranial nerves, because you've done all your, we didn't do this one. Yeah, okay. So I'm gonna have you cover your right eye with my little chart here, please. 'Cause I have another one. So you can cover that right eye, and this is about arm's length. Can you read, let's see, can you read this line for me?
NPD.
And can you then cover the other eye and read this line for me?
CFTZ.
Perfect. And then I'm gonna just cover them for you. All right, perfect. And then can you cover your right eye? I'm gonna cover the same eye, and I'm gonna just hold some fingers out, and you let me know when you see it, if you see one or two fingers, okay?
Sure.
Let's see.
Right there, 2.
Okay.
Again, 2.
And then can you cover opposite eye with me? Thank you. And
2. 1.
I'm not as good with my left hand. Sorry. Very good. So we did confrontation. So your visual fields are intact, and that's cranial nerves 3, 5, and 7 are all the oculomotor and vision. And we did strength is 12. So I think we've done all the cranial nerves now. I think I just missed. Oh nope, total liar. Can you close your eyes? Open. And can you tell me what you feel in that hand?
Paperclip.
Perfect. And then we're gonna do another thing. Same hand. Can you tell me what you feel there?
Cotton ball.
Yes. Perfect. And okay, tell me what you feel there.
Q-tip.
Very good. Yep. And one more thing.
Paperclip.
Okay, and then keep your eyes closed. I'm gonna just draw for you here. What did I draw?
8.
And what did I draw?
4.
And hopefully I say these right, but the sterogenesis, and you may open your eyes, Lindsay, thank you. And the, I can't remember, but they're intact right now. And I think that's it. Okay.
Great.
Did I do everything?
I think so.
Thank you so much for tolerating that exam. Thank you.